Welcome back to our mini series on healthcare. Today we are going to talk about high blood pressure. What is high blood pressure or hypertension? According to research, high blood pressure or hypertension is a condition in which the force of the blood against an artery is way too high. Usually, it is defined as a blood pressure greater than 140 over 90. However, the AHA recommends a blood pressure of 120 over 80 or less to be considered normal. And if the blood pressure is above 180 over 120, it is considered severe. It's an emergency. What causes high blood pressure or hypertension? In some cases, high blood pressure has no known cause, while in other cases, primary aldosteronism is responsible. Primary aldosteronism is a condition that occurs when the adrenal glands produce too much aldosterone, the hormone that balances potassium and sodium in the body. Moreover, overproduction of aldosterone causes the body to retain sodium and lose potassium, and this phenomenon leads to elevated hypertension. There are other causes for hypertension as well, and here are some of them. Cancerous tumors growing on the adrenal glands, or a condition called genetic glucocorticoid aldosteronism. Heart problem, excessive sodium intake, excessive fats and cholesterol, as well as a sugary diet that tends to increase triglyceride levels, leading to hypertension. Age is also another factor that causes high blood pressure. As some people age, their blood pressure tends to increase due to bad diets and lack of exercise. A sedentary lifestyle, too much sitting down and not enough exercise, sleep apnea, obesity or being overweight, diabetes, smoking, using illegal drugs, excessive alcohol intake, and anxiety. I would also like to highlight that there is also a condition called white coat hypertension that occurs only when a client visits the doctor. Otherwise, the client's blood pressure is normal and he doesn't need medication except to control anxiety and reduce stress. How dangerous is high blood pressure? If left undetected or uncontrolled, high blood pressure can damage arteries, damage your organs as well. Example, your eyes, kidneys, heart, as well as your brain. You can incur a heart attack, a stroke, kidney failure, disability, blindness, and death as a result of high blood pressure. What is the treatment for hypertension? To treat hypertension or high blood pressure, first your provider must find the cause of the condition. What's the problem? What is causing your blood pressure to be so high? Your doctor will measure your blood pressure several times, maybe 2 or 3 times, before making a diagnosis. He may also use ambulatory monitoring, a 24 hours device used to confirm high blood pressure. Lab tests include urine analysis, cholesterol tests, blood sugar tests, blood tests to measure your aldosterone and glucocorticoid levels, and an EKG and also an echocardiogram. Also, by making simple changes to lifestyle, a client can lower hypertension significantly. So you may ask, What can I do to lower my blood pressure without taking medication? These are the things you can do. Lower your salt intake. Eat a diet low in fats. Include leafy vegetables, fruits, as well as peas and beans. Cut down on alcohol consumption. Lose weight. Stop smoking. Do more exercise. And as relates to medical treatment, there are several medications available to treat high blood pressure. However, the simplest ones are a class of drug called diuretics or water tablets. And this includes medication like Lasix and hydrochlorothiazide. There are also standard blood pressure medication like ARB, valsartan, ACE inhibitors such as captopril and lisinopril, calcium channel blockers such as amlodipine and diltiazem, as well as beta blockers like atenolol. However, your doctor will decide what type of therapy is suitable for you. He could even decide to use multiple medications depending on how bad your blood pressure is. So everything is rests with your level of blood pressure and your doctor. For a mini series on high blood pressure.